We're back on location today here at Cherry Hill Center, back with Dr. Lloyd. Thanks so much for having us today.
Well, thank you, Mike. I appreciate it.
So, Dr. Lloyd, we've talked a lot about necks and backs on the program, but do you also treat knees?
Yeah, we actually treat every joint, but knees are one of the specialty areas that we do treat.
Yeah, people have a lot of knee pain, and so why, in your professional opinion, why do we have such a problem with knee pain?
Well, you know, the interesting thing about knees, we have two, in your spine you have a disc between each vertebrae, but in each knee you have two discs called meniscus, and two in each knee. And what's really interesting, other people that come into the office, 85% will degenerate the two insides of their knees or the two outsides of the knees, because they're either, like me, a little bit bow-legged. If you're a little bit bow-legged, you're going to put pressure on the inside of your knees, and so you'll degenerate the two insides meniscus. If you're knock-kneed, you'll degenerate the outsides of the knees. So two knees. So if one person comes in, they have one inside degenerated, everything in me wants to look at the other knee because I know it's going to be right there with it. So when we treat a knee, it's much less expensive to treat two than just one. So if you get your car greased, you don't want them greasing one joint, because then they're going to be chasing squeezes. It's going to cost you twice as much. It's easier just to grease the whole car.
Yeah, and that's also kind of what's happening behind us. This is one of your knee treatments that you do. How is this helping people?
This is knee decompression. Well, all joints get their nutrition through the ends of the bones. And if we can create decompression, we create a negative pressure with the knee, drawing the nutrition back into the knee. And so we can create increased space between the knee, allowing cushion between the knee. Other things we do is, you've probably heard of coxcomb or rootscomb, which we call hyaluronic acid. It's a viscoelastic substance that not only lubricates the knee, but creates a cushion. So as we pull that apart, we're going to put these lubricants, this viscoelastic cushion there to separate the knees. And then any kind of, you have a rust on a joint, what are you going to do? You're going to grease and wiggle it. Then the physical therapists come in and start working that knee. So we kind of grease it, pull it apart, and start restoring its main function. The physical therapists are also going to strengthen the muscles above the knee, because the muscles above the knee attach below and pull it together. The muscles below the knee attached above and they pull it together. So those two counter forces are going to pull that knee together and stabilize it. So it's a comprehensive system. We're not just injecting knees with corticosteroid. That's not a good thing. We resist that in this office.
Yeah, it's a full circle treatment here at Cherry Health Center. And folks, relief for your knee is really just a phone call away, and we're going to put some contact information on your screen so you can get in touch with the fine folks here at Cherry Health Center. Dr. Lloyd, thanks for having us back today.
Thank you, Mike. I appreciate it.